Imagine your body's hormone system as this massive, old-school central heating unit. You turn the thermostat up, the furnace kicks on down in the basement,
And the
and
whole house just gets blasted with heat.
right, exactly. Every single room, hallway, closet, all of it.
Yeah, it's a completely systemic response. I mean, the hormone just floods the bloodstream and goes everywhere, whether a specific area actually needs it or not.
And, that's perfectly fine if your entire house is freezing. But what if you only want to warm up, like one specific room, say a small bathroom on the second floor?
Right, with the central system, you can't really do that without turning the rest of the house into an absolute sauna.
Exactly. And trying to avoid that systemic sauna effect is exactly why we're digging into today's stack of sources. Welcome into the deep dive.
It's a really fascinating topic today.
It is. So whether you are prepping for a healthcare appointment or studying up on longevity, or you're just insanely curious about how the human body works, we're glad you're here. We are looking at a mountain of medical data today.
Yeah, we've got FDA clinical review documents, guidelines from the British Menopause Society.
Right, and international clinical trials, plus some really deep dive research papers on female biology.
Yeah.
And our mission today is to cut through all that jargon to answer one specific question.
Can DHEA help symptoms that feel like vaginal laxity?
Exactly. And the short answer from the clinical data is yes. But the mechanism behind it is what makes this so wild. We often think of hormones as systemic, right? Flooding the whole body.
Right, like the furnace.
But the sources reveal this hidden hyperlocal hormone factory inside human cells that might just be the key to restoring tissue structure without those systemic side effects.
Yeah, it acts a lot more like a perfectly calibrated space heater rather than that central furnace.
I love that. But before we get to the solution, we have to talk about the physical reality of laxity. Because a lot of people just chalk it up to getting older or, purely the mechanical stretching from childbirth.
Yeah. Well, childbirth is definitely a factor. I mean, the clinical sources are super clear that pregnancy and delivery put immense physical strain on the pelvic floor. It physically stretches the tissue.
Right, but focusing just on that mechanical part misses a huge piece of the puzzle, doesn't it?
It absolutely does. The other half of the equation, and really the primary focus of these medical guidelines, is the severe hormone crash that happens later in life.
Which, we usually hear about estrogen dropping during perimenopause and menopause.
Estrogen does plummet, yeah, but it is not the only one. The sources highlight a specific hormone precursor called DHEA. And by the time a person reaches menopause, their natural DHEA levels have dropped by about 70% from their peak in their 20s.
Wait, 70%. That is a staggering drop.
It's massive. And this systemic hormone starvation takes a profound physical toll on the tissues. In older literature, you'll see it called vulvovaginal atrophy, or VVA.
But they changed the name recently, right?
Yeah, now the medical community groups these symptoms under a broader term called genitourinary syndrome of menopause, or GSM.
Okay, let's slow down and translate that into what a patient actually feels. Because atrophy sounds like a muscle shrinking while you're in a cast. What's physically happening to the tissue when it loses all that DHEA and estrogen?
To understand that, you have to look at the architecture of the vaginal wall. It's not just one simple layer of skin. It's actually composed of 3 distinct layers.
Okay, what are they?
You've got the epithelium on the surface, the lamina propria in the middle, and then the muscularis, which is the deep muscle layer at the base.
Got it. Surface, middle, deep muscle.
Exactly. And when those tissues are starved of hormones, they literally begin to degrade. The vaginal walls lose their collagen density in that middle layer. The deep muscle layer thins out.
Oh.
And the tissue loses its plumpness and its natural fold, which clinicians call rugo.
So it's basically like a tent where someone came along and removed half the internal support poles. Canvas just sags.
That is a very accurate way to visualize it. When you lose that collagen support and muscle thickness, it just manifests as laxity. It feels loose, unsupported.
And I imagine it causes other issues, too.
Oh, absolutely. It leads to severe dryness, moderate to severe pain during sex clinically called dyspareunia, and even stress urinary incontinence, because those tissues just aren't robust enough to support the bladder anymore.
So if you're listening to this and thinking, well, I've tried standard vaginal estrogen creams, and they didn't really fix that loose feeling, this architecture breakdown explains why.
Right.
If the underlying support poles of the tent are missing, why isn't standard estrogen just the ultimate fix for the whole structure?
Well, Vaginal estrogen is a fantastic first-line treatment, and it excels at restoring that surface lining, the epithelium. It plumps up those cells and really improves moisture.
Which helps with the dryness.
Exactly. But estrogen alone doesn't fully address the deeper structural issues in the lamina propria and the muscularis. To rebuild the deep support poles of your tent, the tissue needs something else.
And according to the FDA reviews, that's where DHEA comes in. Okay, so let's clearly define DHEA, because I feel like I see this acronym constantly on supplement bottles at the vitamin shop, usually for like anti-aging or energy.
Yeah, it's everywhere. So DHEA stands for dehydroepiandrosterone. It's an endogenous steroid precursor.
Meaning it's not a hormone itself.
Right, it's not an active hormone. Think of it as a raw material, a biological building block that the body uses to manufacture both active estrogens and androgens, like testosterone.
Okay, let me just stop it right there. I want to make sure we aren't suggesting people just go buy those oral pills from the vitamin shop to treat pelvic laxity.
Oh, absolutely not, no. The clinical sources, including guidelines from the top institutions, explicitly advise against using oral DHEA for this.
Is that because of the central heating analogy from earlier?
Exactly. Oral DHEA is wildly unpredictable. When you swallow a pill, it goes through your digestive tract, gets metabolized by the liver, and gets pushed into systemic circulation.
So you're turning the whole house into a sauna.
Yes. You're raising estrogen and testosterone levels throughout your entire body. And that systemic exposure can cause side effects like acne, unwanted facial hair, thinning scalp hair, and it can interfere with other medications.
We definitely want to avoid that. We just want to fix the tissue in the specific room.
Right. And the clinically proven method from the phase 3 trials achieves exactly that. It uses intravaginal DHEA, specifically a 6.5 milligram daily insert called Prasterone.
So it's a local application.
Exactly. It's a tiny suppository that just melts at body temperature inside the vagina.
Which brings us to this concept in the papers that totally blew my mind. The mechanism making this work is called endocrinology.
Yeah.
Can you walk us through what that actually means for the cells?
Yeah, it's amazing. The vagina has its own deeply specialized system for processing hormones. When that 6.5 milligram insert melts, the epithelial cells absorb the raw DHEA.
Okay.
And inside those specific cells are these highly specialized enzymes. They take the DHEA and convert it into active estrogens and androgens right there, strictly inside the cell.
See, I was picturing this while reading the research, and it feels like having a hyperlocal 3D printer inside your cells.
I love that analogy.
Like, instead of importing finished goods, the active hormones floating in the blood, the cell just imports the raw plastic filament. The DHEA is that raw plastic.
Right, and it just fires up its internal enzymes.
Exactly. It prints exactly the estrogen and testosterone it needs for its own survival, uses it on the spot, and doesn't share it with the rest of the body.
The FDA data supports that 3D printer idea perfectly because the true magic of endocrinology isn't just local production, it's local destruction.
Wait, what do you mean?
The sources show that 95% of these active hormones are inactivated right there at the site of synthesis.
95% are destroyed locally.
Yes. They do their structural repair work inside the tissue, and then the cell breaks them down into inactive metabolites before they ever leak back into the bloodstream.
That is incredible.
In the clinical trials, they measured the blood levels of testosterone and estradiol in women using this daily for up to 52 weeks. And their blood hormone levels stayed completely within the normal baseline ranges for postmenopausal women.
So systemic exposure is basically zero.
Virtually zero.
Okay, I do want to push back on one specific thing you said, just because I know it might set off alarm bells for people listening. You mentioned the cell uses DHEA to print estrogen and testosterone.
Right.
If we're talking about female biology, doesn't introducing testosterone raise major concerns? I mean, we just talked about the oral pills causing unwanted hair and voice changes.
It's a totally valid concern, and it's exactly why understanding endocrinology is so crucial here. If you are applying a systemic testosterone gel, you'd absolutely risk those masculinizing side effects.
Right, the whole house gets the heat.
But because of the endocrine mechanism, the testosterone is created inside the vaginal cell, binds to the androgen receptor in that same tissue, and is destroyed before it hits the blood. Your chin, vocal cords, scalp, they never even see it.
So the rest of the body is totally blind to it.
Completely blind. But the vaginal tissue desperately needs it, which really brings us back to your question about how this fixes the feeling of laxity.
Right, because we established standard estrogen mostly targets the surface layer.
Yeah, but DHEA's secret weapon is that it provides the raw material for those local androgens. And the anatomical sources show that androgen receptors are heavily concentrated in those deeper layers we talked about, the lamina propria and the muscularis.
So what do the androgens actually do down there?
When the local enzymes convert DHEA into androgens, they go to work on the deep structural foundation. They stimulate fibroblasts in the lamina propria to ramp up collagen production.
Nice.
It physically increases the density and compactness of the collagen fibers, and it stimulates the muscularis layer, improving the thickness of the actual muscle wall.
Wow. It's literally putting the support poles back into the tent.
Exactly. Plus, studies show local androgens increase nerve density in the tissue, which is huge for physical sensitivity and arousal.
You know, if you've been told that laxity is just a mechanical issue that needs surgery, this is a totally different paradigm.
It really is.
By giving the body the raw material for local androgens, you're prompting your own cells to rebuild a deep scaffolding lost to aging or childbirth.
It restores tone and elasticity. And as the sources point out, rebuilding that support has secondary benefits. When you thicken the muscle and boost collagen, you're naturally providing a stronger hammock for the urethra and bladder.
Which helps with the stress urinary incontinence.
Exactly.
The theory is incredibly elegant. But I want to look at how this plays out in the real world. How do we know this cellular 3D printing actually translates to clinical results for real patients?
Well, we know because of the strict requirements for FDA approval. This was based on multiple phase 3 randomized double-blind trials. The big ones are ERC-238 and ERC-231.
And did they just ask the women how they felt, or did they look closer?
Oh, they looked at the physical transformation under a microscope. They measured 2 specific types of cells before and after 12 weeks of daily treatment.
Okay, what were they looking for?
First, parabasal cells. Think of a parabasal cell as an immature, estrogen-starved cell. Visually, it looks like a deflated balloon. It's a hallmark of severe atrophy.
Okay, deflated balloons. And the second type?
Superficial cells. Those are mature, healthy, plump cells full of moisture.
And what happened after 12 weeks of using the DHEA insert?
The reversal was massive. The percentage of those deflated parabasal cells dropped by over 40% in the DHEA groups. In one trial, it dropped 47%.
Wow, almost half.
Yeah. And simultaneously, there was a huge spike in the healthy, plump, superficial cells. The tissue was literally rebuilding itself microscopically.
Okay, that's the cellular data, which is great. But how did that actually feel for the women? I mean, nobody goes to their doctor complaining about their parabasal cell count.
Right, they go because they're in pain, and the primary indication the FDA approved this for is treating moderate to severe dyspareunia pain during sex.
So did it help?
Profoundly. The women reported a drastic, statistically significant reduction in pain, alongside major improvements in severe vaginal dryness.
I noticed in the deeper papers, they also tracked the female sexual function index, the FSFI.
Yeah.
So the benefits went beyond just pain reduction.
They did,
Yeah.
and this ties back to the androgens rebuilding the deep tissue and increasing nerve density. The 52-week studies showed huge improvements across multiple domains. Women reported increases in desire, arousal, natural lubrication, and the ability to achieve orgasm.
Because the structural integrity and sensitivity were actually restored.
Exactly.
Now, there's a secondary cascading effect mentioned in the sources that I found fascinating. It's like a bonus that comes with restoring those healthy superficial cells having to do with the microbiome.
Oh, the pH shift. Yeah, it's a brilliant physiological loop. As those cells mature and get healthy again, they start storing a carbohydrate called glycogen.
Yeah.
Now, a healthy vagina is populated by good bacteria, primarily lactobacilli, and these good bacteria feed on that cellular glycogen. As they eat it, they produce lactic acid.
Which drops the pH, making the environment more acidic.
Yes. In the trials, the vaginal pH in women using DHEA decreased by an average of 0.72 units, bringing it right back down toward a healthy premenopausal level.
And for anyone wondering why acidity matters, an acidic environment is naturally hostile to the bad bacteria that cause UTIs.
Exactly.
And UTIs are a massive problem for women dealing with GSM. So by providing the DHEA, the cells rebuild, feed the good bacteria, restore the acid mantle, and that acid prevents recurrent infections.
It's a beautiful chain reaction of healing.
It really is.
Yeah.
But as with any medical deep dive, we have an obligation to look at the caveats. No treatment is perfect. So what are the side effects of using this suppository every night?
The safety data is really encouraging. Because of the endocrine mechanism keeping hormones out of the blood, systemic side effects were virtually non-existent.
So what was the main issue?
The most common side effect was purely mechanical, application site discharge.
Because it's a physical suppository that melts, and, well, gravity is a thing.
Right, gravity always wins. About 5 to 6% of women reported mild to moderate discharge from the melting vehicle itself. But it was considered so minor that very few dropped out of the trials because of it.
There is, however, a very strict FDA warning attached to this that we have to unpack. The guidelines state that women with a history of breast cancer, or suspected breast cancer, or estrogen-dependent neoplasia like uterine cancer are advised against using it.
Yes, that's a very prominent warning.
So help me square that circle. We just spent all this time talking about how the systemic absorption is basically zero. Why the strict cancer warning if the estrogen isn't reaching the rest of the body?
It really comes down to the extreme caution required in oncology and the limits of clinical trials. The blood levels didn't show a spike, but the trials just haven't been conducted on a large enough scale or for a long enough time, specifically within populations of women with those hormonally sensitive cancer histories.
I see. So it isn't necessarily proof of harm, but rather a lack of definitive long-term proof of safety for that specific vulnerable group.
Correct. Without that specific oncological data, the FDA has to err on the side of caution. The guidelines stipulate those women must not use it without consulting their oncologist and doing shared decision-making.
That makes total sense.
And the sources also note that anyone with undiagnosed, unexplained abnormal bleeding needs to get that fully investigated before starting any local hormone treatment. This is a prescription medication, not an over-the-counter vitamin, so it requires medical supervision.
Absolutely. Looking at everything we've covered, it really is a profound shift in how we understand treating the body. We started by asking if DHEA can help with symptoms of laxity.
And the literature says a resounding yes.
Right, but the method is what's revolutionary. Laxity isn't just surface dryness, it's a structural collapse, the loss of the tent poles, caused by a drop in both estrogen and androgens.
And while standard estrogen fixes the surface, intravaginal DHEA gives the raw material for deeper repair. The cells act as local 3D printers, making their own androgens to stimulate collagen and thicken the muscle, rebuilding the scaffolding.
All while keeping 95% of those hormones trapped locally. The rest of the body is totally untouched. It proves we don't always need to fire up the central furnace and blast the whole house.
Sometimes you just need a really good space heater.
Exactly.
You know, if we step back and connect this to the broader picture of human biology, it leaves us with a truly fascinating question.
Oh, with that.
Well, we've just seen how peripheral tissues like the vagina have this incredible intracrine ability to locally manufacture and destroy hormones on demand, totally off the grid from the bloodstream.
Yeah.
It makes you wonder, what other organs or tissues in the human body might be secretly managing their own private hormone factories? And what seemingly incurable conditions could we reverse if we just learned how to supply them with the right raw materials?
Wow, that is definitely something to mull over. Thank you for taking this deep dive into the sources with us today. Until next time, keep questioning and keep learning.